The job description of a PACU, Post-Anesthesia Care Unit, nurse involves providing specialized care to patients recovering from anesthesia after surgical procedures. PACU nurses play a vital role in monitoring patients' vital signs, managing pain, and addressing any post-operative complications. Their work ensures that patients transition safely from the operating room to recovery, ultimately contributing to positive surgical outcomes and overall patient safety. PACU nurses are employed in hospitals, surgical centers, and outpatient surgical facilities. They collaborate closely with anesthesiologists, surgeons, and other nursing staff to provide continuous, high-quality care. PACU nurses are responsible for assessing patient conditions, administering medications, and implementing post-operative care plans. Their role requires a combination of clinical expertise, vigilance, and the ability to respond quickly to changing patient conditions. Most PACU nurse positions are full-time, although some hospitals offer part-time or per diem roles. Success in this role depends on a strong foundation in nursing practice, attention to detail, and the ability to remain calm under pressure. PACU nurses must be highly observant, skilled in post-operative assessments, and capable of making rapid decisions to ensure patient stability. Primary responsibilities of a PACU nurse. PACU nurses have a wide range of responsibilities that support the post-operative recovery process. One of the primary duties is patient assessment. Nurses monitor vital signs such as blood pressure, heart rate, oxygen saturation, and respiratory rate to detect potential complications early. They also assess level of consciousness, pain levels, and signs of nausea, bleeding, or respiratory distress. Managing post-operative care is another core responsibility. PACU nurses administer medications for pain control, nausea, or infection prevention as prescribed by the physician. They adjust care interventions based on patient responses, ensuring comfort and safety throughout the recovery period. Monitoring and intervention are critical components of the role. PACU nurses recognize early signs of post-anesthesia complications, including airway obstruction, hypotension, or adverse reactions to medications. They are trained to initiate emergency interventions, communicate effectively with surgical teams, and escalate care promptly when necessary. Patient education and discharge preparation are also essential responsibilities. PACU nurses provide guidance on wound care, pain management, activity limitations, and follow-up appointments. Clear instructions ensure patients and caregivers are informed and able to maintain recovery progress at home. Documentation is a vital aspect of PACU nursing. Nurses accurately record patient assessments, interventions, medications administered, and responses to treatment. Detailed documentation supports continuity of care, legal compliance, and effective communication with the broader healthcare team. Midway through this discussion, it is evident that the job description of a PACU nurse extends beyond routine monitoring. It encompasses acute care, rapid intervention, patient education, and meticulous documentation to ensure a safe and effective post-operative recovery experience. Essential skills and qualities for the role. PACU nurses require a combination of clinical, technical, and interpersonal skills. Clinical proficiency is fundamental. Nurses must understand post-anesthesia physiology, recognize complications, and apply appropriate interventions. Familiarity with surgical procedures, anesthesia effects, and recovery protocols is essential for patient safety. Attention to detail is critical. PACU nurses monitor multiple parameters simultaneously, detect subtle changes in patient conditions, and administer precise medications. Small oversights can have serious consequences, making vigilance a key attribute. Communication skills are essential. PACU nurses interact with patients, families, surgeons, anesthesiologists, and other nursing staff. They must convey information clearly, provide reassurance to anxious patients, and collaborate effectively to coordinate care. Problem-solving and critical thinking are vital. PACU nurses often face sudden changes in patient conditions, requiring rapid assessment and appropriate action. They must remain composed under pressure, prioritize interventions, and make decisions that support patient safety and recovery. Empathy and emotional intelligence enhance patient care. PACU nurses provide reassurance, comfort, and support during a vulnerable period for patients, helping to alleviate fear and anxiety while promoting a positive recovery experience. Technical proficiency is important. PACU nurses operate monitoring equipment, administer medications via various routes, and manage intravenous lines or catheters. Competence in using advanced medical devices and adhering to sterile techniques ensures safe and effective care. Teamwork and collaboration are key qualities. PACU nurses work closely with surgical teams, anesthesia providers, and other nursing staff. Effective communication, mutual support, and coordination optimize patient outcomes and ensure smooth recovery processes. Work environment and challenges. PACU nurses work in specialized post-anesthesia care units within hospitals or surgical centers. The environment is fast-paced and requires constant vigilance. Nurses are responsible for multiple patients simultaneously, monitoring vital signs, administering medications, and responding to changes in condition. The work can be physically and emotionally demanding. Nurses spend long hours on their feet, handle patients with varying medical complexities, and respond to emergencies. High patient acuity, post-surgical complications, and unpredictable events require resilience, focus, and stamina. Despite these challenges, the role is rewarding. PACU nurses witness patients' recovery progress, alleviate post-operative discomfort, and contribute directly to successful surgical outcomes. Compensation typically includes competitive salaries, benefits, and opportunities for professional growth, such as advanced certifications or leadership positions in perioperative nursing. Educational requirements and training. Most PACU nurse positions require a registered nursing (RN) license with a diploma, associate, or bachelor's degree in nursing. Additional experience in critical care, operating room, or emergency nursing is often preferred. Certification in Advanced Cardiac Life Support (ACLS) and Basic Life Support (BLS) is typically required, with additional certifications in post-anesthesia care being advantageous. Training focuses on post-operative monitoring, anesthesia effects, pain management, emergency interventions, and patient education. Nurses may participate in orientation programs, simulations, and continuing education to maintain skills and stay current with best practices. Ongoing professional development ensures that PACU nurses remain competent and confident in providing high-quality care. Conclusion. The job description of a PACU nurse highlights a role that combines acute patient care, monitoring, education, and collaboration to ensure safe and effective post-operative recovery. PACU nurses play a critical role in identifying complications early, managing patient comfort, and supporting recovery for a wide range of surgical procedures. For individuals who are detail-oriented, clinically proficient, and capable of handling high-pressure situations with empathy and professionalism, this role provides the opportunity to make a meaningful impact on patient outcomes. Whether working in hospitals, surgical centers, or specialty clinics, PACU nurses contribute to the well-being and safety of patients during a crucial phase of their healthcare journey.